Are you suffering from pain on the outside of your knee that's worse with activities such as running, and finding that things like foam rolling or stretching help temporarily, but the symptoms always return? Hey everyone, this is Dr. Zach Greenwood here, Performance, Sport, and Spine, and today's video we'll be discussing evidence-based management for IT band syndrome. The IT band is comprised of dense connective tissue, and it originates in the hip and runs down the outside or lateral portion of the leg and attaches to the tibia, which is the larger of the two bones of the lower leg, at a thing called the Gerdy's tubercle. And don't forget to like and subscribe to our channel, and then make sure to turn on notifications so you can catch all the latest content. So the function of this amazing structure is to help maintain single leg balance during stance and motion activities, as well as able to absorb enormous amounts of load and transfer them upwards, most notably in repetitive activities such as running. So what does this condition feel like? Well, it commonly presents as pain or tenderness on the outside or lateral portion of the leg, just above the knee joint line. And it's most commonly seen in runners or other repetitive exercises. It's the second most common source of knee pain, and the prevalence varies greatly, but it's been reported as between 12 and 52% of habitual runners will suffer from this condition at some point, as well as between 1 and 5% of military recruits. So what is causing your symptoms? Well, it turns out it's due to excessive compression of the IT band and the underlying structures, rather than the IT band is too tight or some frictional issue. These turned out to be myths that will go in more detail later. And usually this condition is worse with activity, and especially uneven surfaces and running downhill. There also appears to be a fatigue component to this, so this condition will probably get worse the longer you go and as the muscles and tissues get more tired. What's important to take away from this is a classic example of calming things down and then building things back up again. Since this issue is being caused by excessive compression, it's really important to avoid massaging or foam rolling or rubbing the lower part of the IT band where it attaches to the tibia. Because again, if you're compressing that even more with your treatments, you're just going to irritate this condition and make it worse. Now we'll cover the exercises and rehabilitation portion of this video. We've broken the exercises down into 4 different groups with 4 different levels, progressing from 1 to 4. Recommend that you find one of each group and then progress them to your own tolerance. So the assisted step down. So holding onto something with our opposite arm, we're going to start with our left leg as our stance leg. Keeping weight over your midfoot on a small step, we're going to do a step down, tapping our opposite heel to the ground, and then coming back up. When you're doing this, as you step down, it's important to keep the hip, the knee, and the toe all aligned, and minimize letting the knee collapse in, as that can create excessive compression. So again, we're going to step down, keeping our joints aligned, and then step back up. So level 2 would be unassisted. So without holding on to something, we're going to start with our left leg, keeping our weight over our midfoot. We're going to step down, tapping our right ankle, and then come back up. And again, as you move, you want to keep that hip, the knee, and the ankle all aligned. And tension should be over your left leg. And then you repeat on the opposite side. So level 3 is assisted step down with crossover. So again, I'm going to hold on with my right arm and step up with my left leg, and then I'm going to step back and cross my right leg over, tap my toe, and then come back up. You should feel tension on the outside of your left leg or stance leg. Again, I'm going to bend my knee and hip, touching my toe to the opposite side, and then stand back up. And then repeat on the opposite side. And level 4 is doing the same thing without assistance. So we're going to step up with our left leg, and then keeping weight over our midfoot on our left leg, we're going to step back and cross over, tapping our right toe, and then stand back up. And again, it's important to bend your knee and your hip, and we try to place stress for that lateral aspect of the stance leg. Level 1, standing hip abduction. So standing on your left leg, holding on with your left arm, we're going to raise our right leg out to tolerance, and then come back. You should feel tension on the outside of your moving leg, and we should have your knees slightly bent on your stance leg, and try to keep those knees, hips, and ankles all aligned. Level 2 is just standing, doing the same thing. So keeping our stance leg of our hips, knees, and ankles all aligned, we're going to raise our left leg out and come back. And again, pay extra attention to your left leg and make sure you keep that balance and that joint centration, and feel tension over your outside of your right hip. Level 3 is sideline leg raise. So an affected leg up, we'll keep our knees straight, raise your leg up towards the ceiling to tolerance, and then come back down. You should feel tension over your posterior buttocks or back of your hip. And again, prevent your knee from coming forward and keep it back in line with your spine. And level 4 is hip raise with slow eccentric. So we're going to raise our leg up and then come down slow and controlled for 2 to 3 seconds. Again, normal speed up, keeping the leg back, slowly lower down, 2 or 3 seconds. Now this is quite challenging, so start slow and then increase the reps gradually. The box squat. With the box or bench behind you and your feet a little wider than shoulder width apart, we're going to sit down with our hips and then stand up with our hips. Make sure to have weight over your midfoot, and your hips and knees should move as one. Don't let your knees go forward or your hips go straight back. Again, your knees and hips should break, and then stand up. Level 2 is just a goblet squat. So starting with a light weight, we're going to repeat that same exercise, squatting down and squatting up. And again, keep your weight over your midfoot and show tension through your whole legs, knees and hips. And over time, if you want, you can progress to removing the box and doing a full range of motion. Level 3 is the Bulgarian split squat. So with a small step or bench behind you, place your rear foot up on it. Now, keeping your weight over the front foot in the middle, we're going to lunge straight down and then stand straight up. Try to avoid excessive leaning forward of the knee, and again, work on controlling the motion straight down and straight up. Now, this is a little challenging, so it may be helpful to go partially at first, and then as you get more confident, work on increasing the range of motion. And then level 4 would be holding an external weight or load. So in that same position, keeping our weight over our midfoot, go straight down and straight up. It doesn't matter which arm you have it in, it's just external load. And then as you get more comfortable, increase the reps. So a double leg glute bridge. So laying on your back with your knees bent, drive your hips and buttocks up towards the ceiling, hold for a second, and then return down to the starting position. Again, feel tension over your buttocks and hamstrings and minimize any back tension. If you do feel it in your back, you can press your back down towards the floor and then drive it with your hips. Again, sometimes this just takes a little bit of practice to feel it in the right position. Level 2 would be 2 legs up, straighten one leg, and then control it, lower it down, return to the starting position, and then again, 2 legs up, straighten the other leg, and then return slowly to the starting position, and then continue and repeat each side. Again, you feel tension over your posterior buttocks and hamstrings, and then not your back. So level 3 would be a partial single leg deadlift. So what we're going to do is have the weight in the moving legs. We're going to emphasize our right hip. And what we're going to do is we're going to push our leg back and pause, feeling tension in our right hip, and then pulling our body forward using our hip. Again, we're going to push our left leg back, pause, feeling tension here, and then stand back up. And then we repeat this on the opposite side. So once you've mastered that, we'll progress to level 4, which is the full single leg deadlift. So having the weight in the moving leg, so we're going to emphasize our left leg here. We're going to drive our right leg back, let our torso fall forward, feel tension on our left hip, and then stand back up. Don't initiate the movement leaning forward. Drive your leg back, let the torso fall forward, and then pull yourself up with your hip. You want to feel tension on the outside of the stance leg. So it'd be like drive your leg back, feel tension here, stand up. So now we're going to bust 3 myths about IT band syndrome. So the first myth is it's caused by the IT band being too tight. Well, this paper looked at fascia and found that it takes over 2,000 pounds of pressure per square inch to stretch it even 1%. And these are forces above what any human can produce. So this structure is not stretchable. So myth number 2, that this condition is caused by friction of the IT band over the underlying structures. So this awesome paper looked at 3 different parts of this, and they found that 1, the IT band does not roll over the femoral epicondyle. 2, any movement that you feel is an illusion due to changes in the tension of the anterior and posterior fibers, and the IT band doesn't disattach to one spot, but multiple spots. And that this bursa that was often thought as a pain generator is located too deep to be in contact with the IT band. Myth number 3, that this is due to hip tightness from the IT band being too tight. So this study looking at cadavers found that the IT band isn't actually the structure that limits the leg into adduction, but actually it was the joint capsule, the glute minimus, and medius, and all these structures don't attach to the IT band in any way. Two interesting facts about the IT band is first, we're the only mammal that has it due to being bipedal or walking on two legs. And secondly, when you're born, you have no IT band. And due to the stressors of walking, this IT band over time develops into this thick band to help stabilize in single leg fashion. Training modifications. So we're going to need to temporarily reduce provocative activities such as running and let the tissues calm down. Most notably, things like uneven trail running and running down hills are the most irritating for this condition. Some good substitutes in the interim would be cycling or rowing. Then, when symptoms have calmed down, a slow, systematic, incremental increase, and make sure to adapt that progression to your symptom level and don't push too fast, too quickly. And then lastly, gait retraining can be a good variable to incorporate. So the first thing would be to increase your stride width to help reduce compression when you're doing activities such as running. Secondly, reducing crossover or having your foot cross midline will be helpful, and widening this up as we demonstrate here will most likely be beneficial. And then lastly, increasing your stride rate or cadence. This helps because it decreases the stress and forces on your knees and hips up to 10 to 14%. A couple other conditions that can present similarly are distal hamstring tendinopathy. However, this is worse going uphill. It usually gets better as you warm up and get going, and then it's worse at high speeds or the faster you go. Secondly, lateral patellofemoral pain syndrome. Now this is typically worse with loaded flexion. It's worse with stairs, and then it's usually worse with prolonged sitting. Lateral meniscus issues. So this is typically found in people over the age of 40. It's worse on hard surfaces. Pain is usually provoked with loaded flexion and twisting of the knee, and you may experience morning stiffness about 20 minutes. Thank you for watching our video on IT band syndrome. We hope to give us some clarity on what to do and what not to do. Often there's a lot of non-evidence-based management for this condition, so people suffer unnecessarily. If you found this video helpful, please like it and subscribe to our channel, and don't forget to check out our other videos.